get some popping corn, get some wine, pink Moscato, whatever it is, and let's just talk about it. 3, 2, 1. Welcome back to my channel. I can't believe it. Like, I'm grinning from ear to ear, literally. Like, my cheeks are starting to hurt. But thank you. I'm so grateful to absolutely everybody who has watched, subscribed, messaged me. It's too much. I'm like, me, Emanuela. What did I do to deserve all of this? No, but thank you from the bottom of my heart. Like, thank you.
I never experienced it, I just never experienced it. It's too much. It's just, God bless you.
Thank you. Just this support, honestly, it's a lot, and I guess I didn't really realize how much it would actually impact someone or bless someone or help someone. I just thought, well, let me just do this stuff and see where it goes. But I knew it was time, as I said, to come out. So I knew why I was, but I guess the feedback and how people have taken to it is like, oh, well, goddamn. I mean, people are really enjoying my content. And for my very first one, honestly, I was like, I'm not sure. How do I look? How do I that? The sound, the everything. But y'all love it. So thank you. Like, thank you so much. If this is your first time, that's how they talk in it, these YouTubers. So if this is your first time on my channel, welcome. My name is Emanuela Afolabi, and on my channel I'm going to be talking about a bunch of stuff, but at the moment I'm focusing on my health, and that is a condition that I was born with called sickle cell anemia. Without no further ado, I'm going to get straight into it. Last video I talked a lot more about how you can actually be born with the condition sickle cell. So you take the S from your mum, the S from your dad, and that is how someone is born with the full-blown condition called sickle cell. There are other types. I didn't really talk about it in my last video, but there's also something called SC. I'm not all the way clued up on it, but it's a different type of sickle cell. I do know that with them, they don't experience as much pain and hospital admissions that sickle cell patients have. So like I expressed in my last video, I would go in every 3 months like clockwork. But people who with SC can do years and years without a crisis, but they need more blood transfusions. I'm going to talk a bit more about what it actually is, like the science of it, if you know what I mean. What exactly does it do to your blood? What does it look like? And so on and so forth. So I'm going to just kind of go a bit more into detail how it actually works in the body and in the system. Lastly, I will be talking about the most important part of sickle cell, and that is pain. Oh my God, the pain. So as most people know, your blood is shaped like a circle. It moves around your body. That's how it flows. Pumps from your heart, I believe, and then out to your body, and then back to your heart, and so on and so forth. So with sickle cell, what happens is that your blood cells, your red blood cells, turn into a moon, like a moon shape. That's very terrible. I'm gonna insert something, but they form into a moon shape. So imagine it's quite similar to blood clots. Similar in the sense of how the blood stops and it clogs up, but not necessarily the full condition of or what fully happens in the blood. And when someone has a blood clot, I think blood clots, personally, I have actually had a blood clot before. I had a crisis in my leg, around my thigh slash knee, and then from the crisis, I don't actually know how. I think as well because my leg was stuck like this. I was in so much pain. I didn't move my leg like from this position, and so let's say this is your knee. As it clogged up, as my leg was stuck like this, and all the blood was stuck here due to the red blood cells forming into a moon shape. It now formed a blood clot. Honestly, I don't really know how I got it. All I know is that it was so, it was so bad. I had to have crutches. I couldn't walk for ages. They NHS was kind enough to give me like swimming classes. So I don't know what department this comes under, but I knew that they would take me to like a sort of swimming pool to try and stretch out my legs because it was literally stuck. Like you know that animal. What's that animal that stands on one leg and the other leg is arched? Is it a flamingo? I don't know. But literally, I looked like that animal where it couldn't bend. So the swimming classes kind of helped, and the water, I was like warm water and stuff. Like I don't know, I just know it helped kind of ease everything. And then my leg was able to straighten up with crutches and obviously physiotherapy. So I have personally experienced a blood clot before, but it's not exactly the same as a sickle cell crisis. But I'm just using that analogy for you to understand what happens in the blood. So yeah, it clogs up, and then as it clogs up, imagine your red blood cells aren't flowing anymore. Obviously it will now then become very painful, and when that happens, it's basically shortening the supply of oxygen as well in your body. That's why a lot of sickle cell patients, when they do have a crisis, they're on oxygen straight away. They give them oxygen because you need oxygen to flow around you, and oxygen tanks and masks, it helps. I don't know how they say it helps. I don't think it helps. Maybe because I'm in too much pain to, I don't know, realize, or maybe the oxygen, it takes forever to help. I'm not quite sure. But one thing I do know is that I'm always like, I don't want it, I don't want the oxygen, I don't want it. And they're like, no, you need it, it's gonna help. It's gonna help your blood cells flow better, and obviously fluids as well. So those are main treatments. As it clogs up, the red blood cells now become sticky, like very sticky and just very like rigid as well. It's now like it's not as flexible as it would be. So as they get sticky and very rigid, they could get stuck into small blood vessels, and as that kind of happens and it gets stuck, it will also block the flow of oxygen around your body into different parts of your body essentially. So that's why oxygen is really important in while you're having a crisis. And if there's anyone out there in another country and they don't really know that, or that's not a procedure, please advise the doctors, the ambulance crew, nurses, just say, I want oxygen. You're not going to feel like you want it. Trust me, you're going to not want it. You're not going to feel like it's helping, but trust the doctors. And so obviously without enough red blood cells flowing around your body can't get enough oxygen, which can then cause fatigue, tiredness, feeling very weak, very sluggish, very just overall like really just very, very slow as well. It could just drain you pretty much. Not all people with sickle cell are anemic, but I'm also anemic, so it just doesn't really help. It's just a lot of the time they will put you on folic acid because folic acid kind of helps with that. So please ask your doctors to give you folic acid and see if that also helps with just boost your energy as well. When you have sickle cell, your red blood cells break up a lot faster than the usual average person. So a lot of sickle cell patients frequently take blood. So they have it's called either a blood transfusion or a blood exchange. I'm going to explain the two. A blood transfusion is just where they be like, okay, do you know what? Your blood count, it has dropped to about 40 something or 50 something. And by the time you get to the hospital, they would suggest to have a blood transfusion. So they'll check how low your blood count is, and then off of that will then decide how many bags or how many units of blood you will need. So it could be like 2 bags. I've had blood transfusions before. It's not as frequently as some other people. So I think at the max I've had maybe 3 bags or 3 bags. Is it pints? I'm not sure. About 3 bags of blood, 2 bags of blood. But that's on like really, really bad admissions. And then a blood exchange is, they basically, so it's like a machine. They kind of use it for cancer patients. So you'll have a line in one arm and then a line in the other arm if your veins are good, because that's another humongous, I'm going to talk about that probably in another video. The issues with veins, it is ridiculous. Science, please, you guys need to come up with a medicine, a tablet, an injection that will help bring up your blood, your veins. I've had times where literally they've tried 11 times, if not more, trying to get a vein in my arm. They'll try here, it's not working, take it out. Let's try here, put it in, take it out. Try in here, let's try, take it out. Let's try, like my legs are the worst. I've had issues with leg ulcers, so that's a non-negotiable. Like, they're not allowed to go in my legs due to leg ulcers. So literally just trying in multiple places, and eventually we'll get it. But by the time they're done, my arms are sore, my arms are heavy. Literally, I'm quite dark. I'm a dark-skinned girl, but you would see it will look like purpley green. That's how bad the bruising inside my skin. So yeah, a blood exchange is they'll put a line in your arm here, a line in your other arm here, and if they are unable to get lines in your arm, they will go in your groin, and that's called a femoral line. So that is the worst for me. The worst thing. Honestly, I'd rather you try 20 times in my arm. I'm not even joking. I hate, it's too invasive. They have to give you some local anesthesia or gas in there. I don't know if I should insert a picture, but the needle is this long. I kid you not, this long. And it just goes right all the way, like inside your groin upwards, and it makes you feel very uncomfortable. The bag is huge. They will take out 80 to 90% of your blood, and in replacement give you new blood. So this is where, if you're O negative, I think I'm O negative, O positive, OO, that's where that comes in. So they'll give you blood to transfuse you. So it lasts for about 8 weeks, if I'm correct, 8 to 6 weeks. And I kid you not, you will feel like Superman. Like, you will feel so strong, so healthy, because you're basically not living on your blood. And that's the whole issue with sickle cell. Your blood is very weak, very damaged, just not good, essentially. So having 90% of somebody else's blood in you makes you, like, I don't see how you can have a crisis. I don't know, maybe it's possible, I'm not sure, but you can't basically have a crisis because it's not your blood. So technically, for the next 6 weeks, you officially are not a sickle cell patient. Like, wow. I'm bare getting excited, but that's literally how exciting it is for some people who live with this condition day in, day out. So for 6 weeks to 8 weeks, you could be a brand new person. You could be, I don't know how it works, maybe you're AA or AS, because the person's blood obviously is not, the person who donated the blood is obviously not a sickle cell, isn't sickle cell. And I think they prefer people who are AA to donate blood, because people with AA blood is stronger, it lasts longer, and so on. So I'm going to give you a little bit of breakdown in regards to the blood. In a normal, blood cells usually last for up to 120 days. on average, a normal, healthy person, their blood will live before it needs to be replaced. So in everyone's blood, your blood will last for X amount of days and then it will be replaced. But people with sickle cell, their red blood cells last typically, you could Google this, typically between 10 and 20 days. So imagine how hard your body is working to produce red blood cells every 20 days max. Let's just go with the max, 20 days. That is ridiculous. That is absolutely, it's really sad actually. It's actually really sad. Like, while I was researching all of this, I didn't quite realize, damn, that's what my body goes through. Like, that's how hard my body works. And I guess this is why they say a lot of the time people with sickle cell are very strong. They see us as very courageous. They see us as very resilient. They see us as someone who's constantly pushing and fighting. And I guess that's why, because literally every 20 days, our bodies are fighting to produce new red blood cells. That's honestly, that's crazy. And it's like, wow. Okay, so that's a bit more of the science of sickle cell and how the red blood cells actually work and move around the body. Now I'm going to talk a bit more about the pain aspect. I'm going to talk more about the physical pain. I might touch on the emotional. If not, I'll do that in another video. Let me know if that's something you care to hear. As I said, it varies. Some people can go in once a year, once every 5 years, and there's some people that go in dozens of times in a year. Honestly, it just depends. As I said in my last video, what you're eating, the environment, is it warm, is it cold, are you staying healthy, are you looking after yourself, are you stressed out, doing strenuous exercise. Again, all those factors come into play, but generally some people, that's just how it is for them. They just go in so regularly. They can eat, they could be a vegan, they could work out 4 times a week, they can be in a hot country, they could take all their medication, and I guess maybe it's just luck that they just go in as frequently as they do. So it all depends, but I'm going to talk about my experience when it comes to pain. I would say I've got obviously a high tolerance because the amount of pain I go through is insane. And actually, you can research this yourself. They did a pain study and they measured pain. Maybe, I don't know, like, sis, bro, I don't know how they measured the pain. But what I do know is that in the pain study, they found out that a sickle cell crisis is more painful than childbirth. That's actually mad. So that means when I'm ready to have my 4 kids, it's going to be like a walk in the park. I'm going to just sneeze and just have my kids because I know what pain is. Nobody could tell me nada.
I've suffered for this life. What? Nah, forget it. Forget it. I've suffered. Nah, I've suffered.
But it's all good. It's all good, you know. You go through things for a reason, and I guess I went through all of that pain just to share it with you. What is also a factor is the more you have a crisis, so each time you have a crisis, you're damaging your bones, you're damaging your lungs, organs, you're damaging your kidney, and so on and so forth. I usually have my crisis are in my legs or my back. Every now and again, my arms, maybe my shoulder, sometimes chest. I've had quite a lot of chest crisis, but if I've had a chest crisis, it's my chest and my legs, or my chest and my back. And it's possible to have a crisis in multiple places. So it could be your back, chest, leg. It could be your left leg, right toe, head, shoulder, knee. It just varies. So due to that, it damages your bones. So I have chronic pain in my joints. So this isn't having a crisis, this is on a day-to-day basis. I have to take painkillers because of how painful my joints are. The doctors have put it on, the doctors have said it's like mild arthritis, but I don't know. I'm not really buying that. I don't actually think it is that. But for now, that's what they're saying it is. But I just know that I just have this chronic pain, like like going falling asleep and waking up. The pain is there, and during the day, depending on what I'm doing, how active, I feel the pain in my joints. Every now and again, my lower back, I have pains in my lower back. I struggle to bend down. I struggle to stand up. Um, yeah, like just low key, I'm a bit of an old lady. I'm still a young girl, sis. Like, don't try me. Another thing that happens when someone is in a sickle cell crisis is your hands and your feet swell up. So imagine it's just getting clogged, 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 clogged. It's going to obviously build up. So I've had times when my whole hands are fat, like they'll be looking like sausages, or my feet, or my legs. So depending on, let's say I'm having a leg crisis, my whole knee will just be just it just swells up, or my whole thigh will be swollen, it will be red, it will be sore. Something that they give that's like a blood thinner. They help to thin the blood. They inject you in your stomach or your arm with blood thinners just to help the blood move and flow around the body a lot smoothly. Also, frequent infections. It is very, very common to have infection. If I have a cold, automatically, like I just end up with a chest infection or just anything really. Sickle cell can damage your spleen. A lot of people with sickle cell have actually taken out their spleen. I've not taken out my spleen, luckily, so I don't know what it's like. If you are out there and you've taken out your spleen due to sickle cell, please let me know how that's affected you moving forward. Was it helpful? Was it not? Did it make things worse? Did it make things easier? You are forever on penicillin. So penicillin is like an antibiotic. I'm sure most people have heard about it, but it's just a tablet you take twice a day, some people once a day, just to help with infection, because the moment you have an infection, any sort of infection, it's a wrap. Delayed growth in puberty. So red blood cells provide your body with the right nutrition and oxygen to help you grow. That's why a lot of people with sickle cell are also skinny, because they're not getting enough red blood cells to help them grow. I used to be mad short. Like, I think I'm just lucky, like it's in my family to be tall. I was a lot shorter, I was a lot more skinnier, and I didn't actually start my period till I was 16, and I was like super late. I remember in school being like,
oh my god, I haven't started my period. Like, what is it like? Does it hurt? Why are you crying? Why are you saying your stomach hurts?
I just used to ask bare questions, and I'm sure my friends were like, this girl's weird, like why hasn't she started her period? But that's also a factor. So I feel like I look like I've got sickle cell. Sometimes my eyes can be quite yellowy green. They naturally have big teeth and stuff like that. So yeah, it all depends. They have long arms or long legs. Like, not everybody looks weird or funny, but I guess because I'm a sickler, I can look at another person and be like, that person has sickle cell. Like, I just know. You just see it. There's just something about a sickler that you just know that person's a sickler. So yeah, sickle cell can also block the flow of blood to the brain. I've actually had a head crisis before. Till date, that was the worst, like hands down, the worst crisis of my life. If I'm to rank like top 5, the head crisis is definitely number 1. I literally wanted to break my head open, because it was like an inside it wasn't even like a headache. You know, there's a headache and then there's even migraines. No, this was, I can't find the words to describe it. My lips just go numb. The moment my lips go numb, I know, like, even me, Seth, I don't want to die. So at that point, we're calling the ambulance. Ambulance, please. Yeah, you gotta go. So just be careful. Don't stretch your body. If you know, like, you're in mad pain, if you know you can't handle it, don't wait till the last second. Don't wait till like it's uncontrollable. Going earlier. And I think if you go in a bit earlier, they'll be able to control the crisis before it escalates to 1,000 out of 1,000. They could control it, you know, maybe 6/10. And that's advice I would give to anybody, because I never used to take that advice. I would wait till it's like 100/10. Then I'm like, okay, I'm gonna go. But that's actually really, really dangerous. In those moments, you can have a stroke. So be very, very, very careful how long you leave your pain. So also other factors are organ damage, blindness, leg ulcers, gallstones, and a bunch of other stuff. So I have had a stroke in the back of my eyes. Sickle cell can block tiny vessels that supply blood to your eyes. So over time, if that keeps happening and like little parts of your eyes keeps getting blocked, like the blood vessels aren't being passed on, it can literally cause to blindness. Thank God I'm not blind, and I never will, in Jesus' name. There's a section, it's this eye as well. So there's a section, so let's say like this is my whole eye. There's a little section of my eye like here that is blurry. Like I can't see straight. So if I do that, I can see like this patch over my view that I can't see out of properly. And I was distraught. I'll never forget. I woke up one morning and my eye was hurting.
And I was like, this is my eye, bro. What now happened? What did I do? And this eye is hurting. I thought,
okay, let me dim the lights. Maybe it's that I just need to rest. So day 1, my eye was moving mad. Day 2, I was like, no, this is really serious. It was really, really hurting. And so I told my mom, I was meant to drive somewhere, and I literally felt like I couldn't see. I was like, I can't see out this eye. My parents probably thought, oh, this girl started her drama. It's serious. Let me like check it out. So the doctor told me, I'm going to refer you to the eye people as an emergency, because with my condition, anything that goes on with me automatically is an emergency. So I went to the eye clinic. I think they're called, I can't remember what they're called, but the eye department. And then they did checks, they did tests, they put this thing in your eye where all your eyes are blurry and all these different type of stuff. And then I can never forget the last day of my appointment. I went with my mom, and the doctor, worst doctor ever, was like, so Miss Afolabi, basically, you know, you have a sickle cell condition and and essentially you had a stroke in the back of your eye. I said, Mom, I cried. Hey, I cried my soul out. I said stroke. I was finished. Like the assistant doctor was so upset with the way he delivered it. He just delivered it. Yeah. He just went boom. She had to literally tell the doctor, the consultant, give her a minute. Let me speak to her. And she was like, I'm so sorry, he shouldn't have told you like that. Let me explain it a bit more. Don't worry, you're not going blind. Don't worry, it's not, unfortunately, there's no cure. There's nothing we can do to fix it. That's just how your vision is going to be forever. But there are things to prevent it. The man didn't do jack. I cried Sutsi. I cried Shiggy out of my life. But yeah, I thank God I still got my sight, obviously. But that's also another factor when it comes to sickle cell. So be very careful. Please make sure you get your eyes checked every year. Your consultant should be sending you for eye tests and so on and so forth. I am supposed to be wearing glasses, but I don't wear glasses because it just messes up my whole makeup, and I'm just like, no, we ain't finna do that. So essentially, those are some of the things that I've gone through, like with my pain, as I said. But yeah, I don't want to, let me just wrap this up. So anyways, Thank you so much for tuning in again to my channel. Oh my god, this is like, it's now really a thing. When you've done the second one, now it's like, yeah, you officially got a channel, you know. So yeah, thank you so much for watching. Please like, subscribe, share, leave a comment, all of that good stuff. Please support your girl. I need the support. I need to know what you want to know as well. I don't want to be talking about things you're not really interested in. So let me know what you would like me to talk about. Yeah, just give the girl a thumbs up as well. And apologies that this video came so late. I know I said I'll release something every 10 days, but unfortunately it just didn't work out. Not only was I so overwhelmed and like taken aback, but I fell a little bit ill and I just needed time. And with this whole coronavirus, the coronavirus, I was like, oh my gosh, like I need to make sure I take care of myself. So everybody out there, please take care of yourself. Please isolate if need be. Don't be in public spaces. You know, work from home if you can. It is not worth catching this coronavirus. It is not. So please be safe. Thanks again for watching.